Welcome to the XCEL Physical Therapy Podcast. I'm Robbie. I'm here with Michael today, Michael Wyman. We're going to talk a little bit about dry needling, but more specifically about an injury that occurred, maybe 2 months ago to a pretty prominent NFL player. We were talking about this with the NFL's Super Bowl coming up in a couple weeks. Been a pretty big topic, and we thought maybe we'd touch on it a little bit, but then also dive into like possibly what happened and the idea behind dry needling, and if it's safe, is it unsafe, and where we go from there. So just briefly, we'll talk about what happened to J.J. Watt. Michael, if you want to... T.J. Watt. Yeah, just briefly mention what kind of happened to him. Dry needling injury. We don't know all the details. They don't give us a ton of information for obvious reasons. But what we were led to believe is he had a lung injury related to dry needling. If you want to discuss a little bit about that.
It was a spontaneous pneumothorax, which is a fancy term for lung collapse. There's always a risk of that if you're doing dry needling. So we don't know exactly what happened. We'll never know this, right? We're never going to totally hear the story and what exactly happened. But ultimately, the reports are that he did a dry needling session, started having issues, and then they found out he has lung collapse, so they had a procedure, and he missed out on some games, which... It's unfortunate for him. It's unfortunate for the team. It's unfortunate. I mean, I kind of let a little bit of a black cloud over dry needling for quite a while too. So it's unfortunate for everybody.
I don't remember for sure. It took a few days for them to figure out maybe exactly what was going on, right? He was having some issues.
That's what it sounded like. Yeah, it's hard to tell. There's so many different ways of doing it that you just never know. So
that leads me to my next big question I have for you. Is this a common thing? Do we hear about this a lot, or is it fairly rare? What do you know about it?
It's a good question. So actually the research shows, McCutcheon wrote a research article, and this was primarily with acupuncture, so it's you take it with a grain of salt. But anytime that you insert a needle into your tissue, the risk is actually 0.01 to 0.1% chance a spontaneous pneumothorax due to a needle.
Let's say that again.
So 0.01, 0.1% chance.
0.1%. So
less than 1 in 10,000 cases.
Okay.
So the World Health Organization clarifies that as very rare. It's a rare thing that occurred. Unfortunately, it happened on a big stage. But I think it's important with these cases, and when something like this happens, you take this as an opportunity to reevaluate and reassess, and address it and try to figure out. We don't know exactly what happened, but I think it's important to acknowledge that it can happen and reevaluate kind of, techniques, but also understanding where you are in space and understanding tissue depth and respecting the tissue. So anytime you're on the thorax, chest, you name it, there's a risk of this. So it's a good opportunity to step back and reevaluate that.
And you mentioned something with acupuncture there. A question I personally get from a ton of patients that come in for therapy is, how is dry needling different than acupuncture? Are they different? Can you maybe talk about that?
Yeah, there's similarities and differences, right? So acupuncture, and I'm not an acupuncture specialist, so it's hard to speak on it, but what I would say from what I know is that acupuncture, when you insert the needles, you're essentially trying to release power or chi. So you follow meridians. Sometimes you do more needles, sometimes you do less, but the idea is to release power and energy flow in the body.
Okay.
And then there's blood flow components that come with that. That's more kind of the Eastern philosophy of medicine, whereas I would say dry needling is more Western philosophy. So that's more along the lines of, we test the tissue, we know it's strong, or we know this one's weak. So if this one's weaker and we feel and we palpate it and we find stiffness or dysfunctional tissue, that's where we're going to address that. So instead of just following the body of meridian and chi, we're finding tight muscle. We go after that muscle, for instance.
Okay, so that's a good point. That was the next thing I was going to ask you about, was if you could describe dry needling in more simple terms to help people understand kind of exactly what we're looking for, what we're feeling for. Is there a certain type of tissue quality that we're addressing with that? And I think you hit on that a little bit. Is there anything more you would add?
Yeah, I think it's, post-surgical or like chronic pain, for instance. The thing that I think is best to, like a great example would be like your upper traps, right? You think of people are always complaining of tightness up in their traps, and they have those active trigger points that are really irritable. Those are the type of tissues that you usually address with dry needling. So the goal is that those are called hypertonic tissues, so they're stiff and dysfunctional. When you have a tissue that's dysfunctional like that, it tightens up. And when it tightens up, it impacts your blood flow and nerve stimulation. So therefore, you take that needle, you go after that tissue to release that, and it brings blood flow and nerve stimulation back. There's some lymphatic drainage, so there's a lot of benefit from it. It can be very effective if done correctly and daily.
Yeah. So you're doing a great job leading me into the next thing I was talking about was there's obviously some significant risks that happen to somebody on a high profile stage, but what are some other risks that maybe we don't know as much about that can happen that, something does go a little bit off or a little bit wrong that we need to bring up too?
Sure. Once again, it's really rare. So there's always a checklist of things you go through in your mind, right? And you ask the patient consistently and you keep in constant communication with them so they know what to expect, but also kind of what your response should be. So in terms of a contraindication list, first trimester of pregnancy. So if a patient potentially could be pregnant, my younger women, I ask them all the time, is there any risk? Is there any chance that you might be pregnant at this time? So we never do it on somebody who's the first trimester of pregnancy. If they have any active tumors or cancers in their body, we need to be aware of that. Pacemakers, I typically don't, just simply because of, I don't know what the response is going to be. It's not always a contraindication, but I'm just a little bit more passive with that. The other thing, I think, patients who are maybe mentally unable to tell me exactly what they're feeling.
Okay.
And then the other big one that people don't really think of is people who are potentially ill. Like maybe the day before you're feeling kind of worn down, maybe somebody in your family's got a cold, or if you're like the flu's going around your family,
Okay.
I will wait at least 24, 48 hours, maybe not a week.
Interesting.
The reason behind that is when you insert a needle into the tissue, that there's a neurological response that occurs and blood flow flushes to that tissue. So if you have a virus in your body that's dormant, but it's gradually building and attacking you, you may feel worn down, but that'll trigger that immediately and it'll cause an adverse response.
That makes sense.
They'll get really sick really fast.
Okay. It's a good point. Yeah. Couple more questions I have for you. So Watt's a very big athlete. I mean, what is he, 250, 300 pounds? A lot of muscle mass. Mm-hmm. Does that change things if you're working with somebody with that kind of body size or body mass as opposed to maybe just your typical people that we see every day, that maybe aren't 300 pounds of just pure muscle, that they work at a desk most of the day or something like that,
It can be challenging, right? So I think that's where I think taking this case and stepping back and reevaluating it, but also I think it's important to respect the patient and your tissues. Anatomy can be tough to find because it's a little bit different for everybody. We have consistencies, but then there's inconsistencies, as you know. So anytime we're doing a needling around the thorax or in like the pecs, for instance, or traps, there's variances that occur to everybody. So it's always important just to know your landmarks and feel comfortable with where you are in space. And it's one of those situations that maybe from an experience factor standpoint, if you're not comfortable in that spot, we just don't do it, right? There's other ways of treating and managing these type of conditions. So just having respect for that tissue and respect for that patient and acknowledging that there's differences for everybody, because another thing we didn't touch base about is COPD and emphysema. So if somebody's got COPD or emphysema, your lungs tend to be hyperinflated. So your lung tissue could technically go into your rib cage and your rib field. So if you're in the mid back or anywhere around that, there's a higher risk.
Okay.
But also some people's lung fields go all the way down to L2 in the low back. So if you're trying to needle somebody in the low back, being aware of that could be important.
Yeah.
Right. So being respectful and mindful of the anatomy and respectful of the patient. So it's important to just keep up constant communication. But once again, it's very rare that it occurs, but it's good to step back and reevaluate the case.
And then when this happened, a few months ago, I did have some people asking me, maybe a little more apprehensive about, maybe they've had it done in the past and they weren't too concerned about it, but now they're, because of this being a big story, they're a little more conservative or mindful that this could be a big side effect. What would you tell people that are on the fence about doing it, that after hearing this news story, they're like, oh, maybe I shouldn't do that, but in your opinion, maybe they would benefit from it? How would you talk to that person?
So I think that's a great question. So I think educating the patient is important, right? And understanding that these are the risk factors. These are things that could happen. if anything like that were to ever happen, these are it's essentially the side effects, but also what you would expect symptom-wise. I think for somebody who would be on the fence about it, I usually give it to them in terms of what they would like to do. This is your care. This is your treatment.
Right.
If I think this is advantageous for you, I'd like to educate you on that and what we could do with this. But it's not the holy grail, right? We want to combine that with other treatments. So there are other ways of managing cases like that. But usually what I tell people is that this is a way for me to get there a little bit quicker for me personally. So if that's the case, this is what I would recommend. And I feel very confident and comfortable with it. But that being said, they know that if they don't, we want to provide options, right? It's definitely their care, and it's a two-way street. So I think it's important to open that line of communication and make sure that they know that there's other methods and other options. Yeah, but it's still a very effective mode of treatment, and 0.01 to 0.1% chance is pretty rare.
Right.
But it's a good way to let it can happen.
Yeah. That leads me to my last question. I kind of want to wrap this all up, put a little bow on it. Is dry needling something that you would do in isolation, like by itself, or is there something else that we do with it in conjunction with it that would help the overall healing process, the overall mechanism of efficiency of it? Or, what do you think about that? What are your opinions on that?
So dry needling is considered a modality. And what that means is in our line of work is that it supplements your care. So it's not the holy grail. It's not everything. It can bring blood flow. It can bring nerve stimulation. It can bring lymph drainage. There's a lot of benefits physiologically it can do. But you need to complement that with something else. When you see changes, we need to capitalize on those changes and make sure that we move forward from that. So dry needling isolation can be helpful, but in terms of long-term results, is it going to make the total change? We still got to put in the work to make that change last long-term. So it's more of a complement to your care. It's a modality to care. So that in isolation is not going to make the change. But that being said, you can make a pretty significant physiological change in a matter of minutes. So if that's the case, you want to utilize that in combination with whatever else you can do. Long-term, you should have more benefit.
Awesome. All right. Thank you very much, Michael. Appreciate it.
You bet, bud.
Very educational. Yeah. If you guys have any questions, please reach out to XCEL Physical Therapy. We'll be more than happy to try to help you out. And we'll do another one soon.
Sounds good. Join the Bearded Brothers.